I hope this finds everyone well. I know this format is a bit different than what I was expecting when asked to speak. And due to the circumstances, I know this is the safest way to be presenting to you today. I would like to thank the coordinators of this event for inviting me and for including the topic of acupuncture in the Art of Living Beyond Cancer conference. My name is Sara Kowalik. I have a master's in acupuncture and oriental medicine. I am board certified and licensed to practice in the state of Nebraska. I have been practicing and studying acupuncture for 10 years, and I have also included a few extra special topics in my training, which include acupuncture for the cancer patient, acupuncture for hospice and palliative care, and auricular therapy, which is acupuncture on the ear. My goal in today's presentation is to help you understand healing energy and how you can incorporate acupuncture therapy into your routine of care. I will cover the concept of energy and qi. I will explain the basics of acupuncture, when you might choose to use it, and what research has to say, as well as some of the most commonly asked questions about acupuncture. Energy is life. As Albert Einstein said, everything is energy, and that's all there is to it. The ancient Chinese energy healing term qi is often used in explaining acupuncture. But what is qi? In order to understand qi, we first need to understand the concept of energy and how it relates to our body. Qi is translated as life force. Life force is what animates our bodies and includes the responsibility for why our heart, brains, and nervous systems work. Qi is the electrical ion signals that each and every one of our cells gives off. And these can be recorded by modern devices such as an ECG for heart, the EEG for brain waves, and even your smartwatch, which monitors heart rate and sleep patterns. The qi energy on our bodies flows through a network or pathways called meridians. You can think about these meridians as a network of waterways. There are 14 major meridians and a network of minor meridians as well. They connect the interior to the exterior of the body from head to toe. And just like having 2 arms and 2 legs, each meridian branch is mirrored on both sides of the body. The major meridians are each named after an organ in your body. The meridians are connected, and the qi energy flows through these meridians in one direction and has a stronger presence in each of the meridians for a 2-hour period each day. Acupuncture points fall on these meridians and are utilized to access and manipulate qi energy. Each acupuncture point has its own energetics and therapeutic use. The pain, symptoms, and disharmonies that you may experience have a relationship with the meridians and the organs that they're named after. The time of day you experience symptoms may also indicate which meridian is being affected. Say you have trouble sleeping and wake every night at the same exact time. As put by author Daniel Reed in his book, The Complete Book of Chinese Healing, Health and Healing, Guarding the 3 Treasures, meridians not only feed vital energies to their related organs, they also reflect any pathological disturbance in those organs, thus providing a convenient and accurate tool for diagnosis as well as therapy. With advancements in technology, science has confirmed the existence of meridians. First discovered in the 1960s by a North Korean scientist who described a new tissue in the body as a thread-like network of fluid-filled connective tissue that encompasses the entire body. He used the term premovascular system. Now we are naming this organ or network as interstitium. And it is located and follow the same pathways as the ancient Chinese acupuncture meridians. Experiments have been done on these meridians with lasers. They shine laser light into an acupuncture point and are able to detect that light in another place along the meridian. When they choose a random spot to put the laser light into, it cannot be detected anywhere else in the body. Science and the medical profession have accepted the existence of the meridian system as an integral part of human functioning. Acupuncture is a holistic system that is over 3,000 years old. As I stated, acupuncture points are found on the meridian systems and are used to adjust the flow of qi. The actual process of acupuncture therapy uses very fine needles placed into specific points on the body and are chosen based on the person's symptoms. A typical treatment will usually utilize between 8 and 12 points. Once needles are inserted, they're left in place for about 30 minutes where a person lies still and is usually able to take a nap. The goal of acupuncture therapy is to make sure qi is moving smoothly and freely and distributed equally throughout the body. It is believed that you are in good health if your qi is strong and moving smoothly and freely. Imbalances or blockages in the flow of qi results in symptoms of pain or disease. Over time, the body is more susceptible to developing disease due to imbalances that are reoccurring. As I stated already, it is a disruption or imbalance in our qi that is responsible for symptoms or disease. And there are many things that can disrupt our qi, including obsessive thoughts, worry or grief, stress, overwork. This can be both physical work or mental work like studying. Too much exercise or too little movement, poor diet, dehydration, exposure to chemicals, electromagnetic frequency pollution, injuries or surgery, and weather exposure. For example, even going in and out when it's hot outside can be a huge shock to your body because there's such a significant difference between the outdoor temperature and the indoor temperature. Usually this time of year, a minimum of probably 25 degrees, and in the winter, it's probably even more. The key is really balance in all things. So now we have covered the basics of acupuncture therapy and how symptoms emerge from imbalances in qi. The question you are probably asking is, what can acupuncture treat? Most people know that acupuncture is great for treating pain, and it is, but there are many other common conditions that acupuncture can treat as well. The list of conditions that acupuncture can treat is long and varied, but I'm going to focus on the list of conditions that have been proven and demonstrated to be effective and safe for cancer care. This list includes pain relief, nausea, vomiting, diarrhea and constipation, appetite issues, dry mouth, sleep, hot flashes, anxiety and depression, and fatigue. So we went over a list of symptoms that are related to cancer care, but there are other things acupuncture is going to be able to take care of. And it's important to know that a lot of things that you might be experiencing that are considered to be normal, like acid reflux or headaches, even allergies, they're not something that are something that you should have to live with the symptoms. They're not normal. It's common that people have these things, but treatment can help alleviate them. Now we know what acupuncture can treat. Let's look at some conclusions of published research studies. These first couple studies are on the treatment of pain in general. In a paper titled Acupuncture for Chronic Pain, an update and critical overview published in the journal Current Opinion in Anesthesiology, concluded that mounting evidence supports the effectiveness of acupuncture to treat chronic low back, neck, shoulder, and knee pain, as well as headaches. Additional data are emerging that support the use of acupuncture as an adjunct or alternative therapy to opioids and in perioperative settings. Another study published in Neuroimage demonstrated acupuncture to activate a number of the body's own opioids, as well as improving the brain's sensitivity to opioids, making it a reasonable choice to mitigate pain. A meta-analysis of over 17,000 patients from randomized trials published in Archives of Internal Medicine in a paper titled Acupuncture for Chronic Pain concluded that acupuncture is effective for treatment of chronic pain and is therefore a reasonable referral option. And a truly groundbreaking study published in the American Journal of Emergency Medicine titled Acupuncture versus Intravenous Morphine in the Management of Acute Pain in the ED stated that acupuncture, one of the oldest techniques to treat pain, is more effective, faster in relieving pain, and with less adverse effects than intravenous morphine. And a research study for cancer in patients published in JAMA Oncology in 2019 in a paper titled Clinical Evidence for Association of Acupuncture and Acupressure with Improved Cancer Pain, a systematic review and meta-analysis concluded that acupuncture reduces pain levels for cancer patients based on meta-analysis of 14 randomized control trials. I know that's a lot of boring statistics based on research, but I think it's important to understand that even though acupuncture is an ancient Chinese medicine, that there's a lot of modern science that backs it up now. So let's look at a couple of studies regarding acupuncture in cancer care. In the publication Hematology Oncology Clinics of North America, an article titled The Value of Acupuncture in Cancer Care states that recent advances in acupuncture clinical research suggests that acupuncture may provide clinical benefits for cancer patients with treatment-related side effects such as nausea, vomiting, postoperative pain, cancer-related pain, chemotherapy-induced leukopenia, post-chemo fatigue, dry mouth, and possibly insomnia, anxiety, and quality of life. There's also growing evidence for including acupuncture as standard care in cancer programs. In a Huffington Post article posted by a contributor, Lorenzo Cohen, PhD, professor and director at Integrative Medicine Program, University of Texas MD Anderson Cancer Center, in a paper titled Time for Acupuncture to Become Part of Standard Care, reported on the systematic review conducted by researchers in the Integrative Medicine Program at MD Anderson Cancer Center. The review was published in the journal Clinical Oncology and is being used to help cancer patients and their oncologists make choices about the use of acupuncture in the management of symptoms during cancer care. The review included 41 studies for the treatment of 8 symptoms. 11 were on pain, 9 showed positive results for the use of acupuncture for pain relief. There were studies on nausea, vomiting, postoperative constipation, dry mouth, hot flashes, fatigue, anxiety, depression, or mood disorders, and sleep. These studies were all rated for quality and whether outcomes were positive or negative. Continued research is needed, but it was concluded that acupuncture is a low-risk, cost-effective treatment option that may be beneficial for cancer patients suffering from treatment-related side effects or in those for whom other treatment approaches have failed. At Memorial Sloan Kettering Cancer Centers, they use a holistic approach based on scientific evidence, which has included acupuncture therapy since the mid-90s. The chief of integrative medicine presented a new study in May of 2020 comparing the effectiveness of electroacupuncture and auricular acupuncture, that's the ear, versus usual care for chronic musculoskeletal pain. The study found that among cancer survivors with chronic musculoskeletal pain, both electroacupuncture and auricular acupuncture effectively reduced pain and improved quality of life. There are many other studies that demonstrate the effectiveness of acupuncture and that it improves the outcome, well-being, and survival of patients. Chen Li Fu from China Medical College in Taiwan stated, traditional and Western physicians should abandon their prejudices and value the differences between their systems. They should treasure the mutual common sense of both systems, disregard what is useless or harmful, and strive for the full growth and development of the best aspects of both systems, so as to incorporate the two in bringing forth a new medical system. So we have an idea of what acupuncture can treat, and that research is confirming that is a beneficial option during cancer care. But is it safe? The FDA has approved and regulated acupuncture in the United States since 1996 and is generally considered to be safe when performed by a qualified licensed practitioner. The FDA also requires the use of single-use sterile disposable needles. Potential risks include slight pain following treatment at the needle site, minor bruising, possible bleeding, which usually includes a couple of drops if any, and in someone with a compromised immune system, a very small but rare chance of infection. The number of complications reported to the FDA is low, and millions of people successfully get treated with acupuncture every year. When choosing an acupuncture provider, here are some things to consider. Not all providers who offer acupuncture are trained the same. Consider a licensed acupuncturist to be a specialist in the field, where their graduate level training is solely focused on acupuncture. There are other professionals who perform acupuncture with their specialty in another field. Nebraska and Iowa have regulations and licensure for acupuncturists. Requirements for becoming a licensed acupuncturist in Iowa and Nebraska include graduate level training, which includes more than 3,000 hours, and to obtain the Master of Science in Acupuncture and Oriental Medicine. You also have to take up to 4 national board exams administered by the National Certification Commission of Acupuncture and Oriental Medicine, known as the NCCAOM. Each state and the NCCAOM also require professional development and continuing education to maintain certification and licensure. The bottom line is ask what training the provider has had before choosing who you have perform acupuncture. In Nebraska, chiropractors, PTs, and even dentists can perform acupuncture with a minimum of 100 hours of continuing education. So I've prepared some commonly asked questions that I'm sure are on your mind that I may not have covered. The first one that always comes up is, does it hurt? Of course, acupuncture uses fine needles, but they're nothing like the medical needles that you may have experienced in the past. When inserted, you may feel a slight prick or a pinch, or nothing at all. After the needle is in place, you may experience a dull or achy sensation, or even a feeling radiating through the meridians. How many treatments do I need? Because everyone is different, there is no exact answer. Acute problems usually resolve in 4 to 6 treatments. Chronic issues will take longer to resolve, with treatment plans usually starting with treatments 1 to 2 times per week for about 6 weeks. Maintaining your health and preventing disease is just as important as resolving symptoms. So once symptoms are controlled, or if you are healthy, a monthly treatment is best to boost your body's defenses for prevention. It is important to know that acupuncture works in a series of treatments, and it's accumulative. So it's similar to how exercise works. I use the explanation of an escalator. When you're trying to go up an escalator that is moving down to you, if you only take 1 step up, you're going to end up back at the bottom. So you have to time your steps to move up that escalator accordingly to make it to the top. Acupuncture treatments need to be spaced out the same way that you're spacing out your steps going up that escalator that's coming down. You can never have treatments too close together, but you can space them too far apart. The goal is to have treatments close enough together so that your symptoms can improve. So what can I expect from my treatments? You're normally going to feel better after the first treatment, but in order to really shift your symptoms so that the change holds, you will need to complete a series. The next day you might even feel the same as you did before treatment, but it is important to recognize that there's a lot of healing going on inside your body that you may not even realize is taking place. And does insurance cover acupuncture? Unfortunately, currently in the state, there are very few companies that have acupuncture included in their policy. Things are changing, but it is slow. There is work being done to have Medicare cover acupuncture, which will lead the way to more insurance coverage. I know we all pay good money for our insurance plans and want to take advantage of the policies, and even tend to make choices based on the coverage offered. Acupuncture out-of-pocket costs are reasonable and a lot of times fall in line with a specialty copay. And the care is an investment in your health. I will leave you with this quote from Daniel Reed. Energy medicine holds the potential to revolutionize healthcare throughout the world, and it's high time it did. Thank you. I appreciate you tuning in, and I hope that you have learned some valuable things about acupuncture and will utilize this information to include acupuncture in your pursuit for healthy living.
At Methodist, our doctors, nurses, and team members work together
to provide the expertise and compassion
every patient deserves
for excellent care.
Methodist, the meaning of care.